Abortion revealed. I'm going to lay a foundation of information concerning this subject of abortion. First, we must look at facts. Abortion is happening at a rapid rate. What is abortion? A vacuum aspiration abortion at 8 weeks gestational age, 6 weeks after fertilization. Approximately 205 million pregnancies occur each year worldwide. Over a third are unintended, and about a fifth end in induced abortion. Most abortions result from unintended pregnancies. A pregnancy can be intentionally aborted in several ways. The manner selected often depends on the stage of the embryo or fetus, which increases in size as the pregnancy progresses. Specific procedures may also be selected due to legality, regional availability, and doctor or patient preference. Up to 15 weeks gestation, suction aspiration or vacuum aspiration is the most common surgical method of induced abortion. Manual vacuum aspiration, or MVA, consists of removing the fetus or embryo, placenta, and membranes by suction using a manual syringe, while electric vacuum aspiration, EVA, uses an electric pump. God told me that babies are still being aborted at 36 weeks. It is illegal, but America has opened the door, and now they do this beyond the law. The speed limits many times are set as limits, but that just causes people to go beyond the limit. The same goes for abortion. If someone shoots a pregnant woman to a certain term, they can be tried for a double murder. The law protects rights of life in one area, called murder of the baby in the womb, but not in the abortion of the baby. From the 15th week of gestation until approximately the 26th, other techniques must be used. IDX is sometimes called partial birth abortion, which has been federally banned in the United States. Generally, the former position argues that a human fetus is a human being with a right to live, making abortion morally the same as murder. The latter position argues that a woman has certain reproductive rights, especially the choice whether or not to carry a pregnancy to term. They have the right to choose. Well, they have the right to choose to have sex, so maybe that ought to be stopped if they have an abortion. Sex-selective abortion. Sonography and amniocentesis allows parents to determine sex before childbirth. The development of this technology has led to sex-selective abortion, or the termination of a fetus based on sex, male and female. The selective termination of a female fetus is most common. How many times are there a false reading of a sonogram and they abort because it's not what they wanted, or a possible defect? If the reading is false, it doesn't matter. Sex-selective abortion is partially responsible for the noticeable disparities between the birth rates of male and female children in some countries. The preference for male children is reported in many areas of Asia, and abortion used to limit female births has been reported in Taiwan, South Korea, India, and China. This also happens in America. No one should be able to get pregnant and then abort because there is or isn't a penis. This deviation from the standard birth rates of males and females occurs despite the fact that the country in question may have officially banned sex-selective abortion or even sex screening. The following quotations are taken directly from medical and psychological studies on teen abortions. About 20% of all abortions taking place in the U.S. today are performed on teens. Teenage abortion has been linked to a number of physical and psychological problems, including drug and alcohol abuse, suicide attempts, and suicidal ideation, and other self-destructive behaviors. The number and types of physical complications resulting from abortion are as diverse as the various abortion methods. Depending on the type of abortion performed, physical complications can be as follows: cervical tearing and laceration from the instruments, perforation of the uterus by instruments. This may require major surgery, including hysterectomy, scarring of the uterine lining by suction tubing, infection, local and systemic, hemorrhage and shock, especially if the uterine artery is torn, anesthesia toxicity from both general or local anesthesia, resulting in possible convulsions, cardiorespiratory arrest, and in extreme cases, death. Retained tissue indicated by cramping, heavy bleeding, and infection. An enlarged, tender, and soft uterus retaining blood clots. Failure to recognize an ectopic pregnancy. This could lead to the rupture of a fallopian tube, hemorrhage, and resulting infertility or death if treatment is not provided in time. Listen, church, we preach the Word of God, but we shy away from truths such as abortion and its effects on America's people. Some women experience immediate psychological problems from abortion. Other women repress feelings of guilt, delaying emotional reactions sometimes for several years, and oftentimes triggered by their first planned pregnancy. These complications include sad mood, sudden and uncontrolled crying episodes, deterioration of self-concept, sleep, appetite, and sexual disturbances, reduced motivation, disruption in interpersonal relationships, extreme guilt and anxiety, psychological numbing, depression, and thoughts of suicide. It's easy for a young man to ask his teenage girlfriend to abort their baby so it doesn't hinder his future. The females of this world are chronically affected by this procedure. Men can continue their sexual egg hunts with no effects. Many Christians have had abortions. The reason being is because the church doesn't look beyond the surface of this. China kills babies freely, but America is supposed to be the land of the free. Babies are desired by many through adoption. We need to ask God to have mercy on America for abortions while the church sleeps. What happens to created aborted babies? They are thrown away in the garbage. We need to pray, write our political leaders, preach about these type of subjects, and take a stand as a church.